Thank you for being here. I want to get a little idea about who all of you are by just show of hands. And if you don't raise your hand, I'll assume that the number's 39. Under 65? And if you want to close your eyes and do it and make it anonymous, 65 to 70? 70 to 80? 80 to 90? 100? 100? Well, you walked in on your own. You're eating. You walked in on your own. You're eating. And you're speaking, and you're coming to hear the lecture, so I think you should give the lecture. Because successful aging, how's that? No. So general health issues of aging. Aging is a big topic. Geriatrics is a big topic. I'm going to focus on what you can do for yourself without a physician to maintain independence. That's what I hear patient after patient, is that you want to remain independent. Add life to my years, not necessarily years to my life, unless they're good, independent years. One of my resources for the talk today is Dr. Seuss, You're Only Old Once by Dr. Seuss, a book for obsolete children. And in the cover here it says, is this a children's book? Well, not immediately. You buy a copy for your child now, and you give it to him on his 70th birthday. And if at any time you want something clarified or you want to ask a question, please don't hesitate to interrupt. I want to make this somewhat of a dialogue here. So, aging. The US is definitely aging. So here you see year 1900, then 2005, and there's 2050. On the other side is the number of people over 64 in millions. So 3.1 million in 1900, 82 million projected by 2050. Now, in 2009, if you were a white male, age 85, in 2009, you would have expected life expectancy 5.8 years. So that's almost 91. If anything now, in 2013, it would be more years. Don't pay attention to the numbers. We're just going to kind of look at causes of death. Leading causes of death in what I like to say is mature adults. Heart disease, cancer, COPD, which would be emphysema, chronic bronchitis, stroke, the cerebral vascular disease, Alzheimer's disease, so that's number 5. Diabetes, influenza and pneumonia, and I hope you all got your shots. And then kidney disorders, Dr. Roy could speak to that, and accidents, falls. In accidents, falls are the #1 killer of seniors. And then it's blood infection. So, falls. If you're living out in the community, each year, older folks living in the community, 30 to 40% of us will fall each year. If you're living in a nursing facility, a nursing home, 50%. So again, incredibly common. These are percentage of folks living in the community over age 65 who will fall in 1 year, 30 to 40%. But why do we care about falls? Most people don't bounce. So this is, if you have a history of a fall, in the year, you have a 60% chance of having another fall. Complications of falls are the leading cause of death from injury if you're in the mature adult category. Most falls, there's going to be some sort of injury. 10 to 15% of the time, when an older adult falls, they'll have a fracture or another serious injury. Another serious injury could be hitting one's head, blood accumulates between the brain and the skull, something we call a subdural hematoma, but falls certainly can cause injury. And as you get older, you're more likely to die from the consequences of the fall. And just looking at white men age 85 or older, 180 deaths per year per 100,000 population. So what happens? You're not going to do as well after a fall. Increased likelihood of nursing home placement. Increased use of physicians, rehab facilities, orthopedic surgeons, and the fear of falling. Sometimes the fear of falling is worse than the fracture, is worse than the debility. Half of those who fall are unable to get up without help, what we term a long lie. Emergency response system, the help me, I've fallen, I can't get up button. My rule of thumb is, if you're 80 and older, living by yourself, you need one. And I tell my patients, wear it all the time. I tell them you can take it off if you're going to fly to China. Otherwise, you wear it all the time. Unfortunately, I've had patients who take it off when they go out, come back in, it's right there, but you gotta go pee. And so you forget, you're running to the restroom, the bathroom, and it's up right there on the doorknob. And I've had, unfortunately, patients fall, unable to get up, and their help me, I've fallen, I can't get up button is where they can't reach it. My mother, at about age 80, she was willing to get one of the buttons and wore it faithfully, and when she would come down here to Florida, would bring the equipment. She came down for a wedding of a friend, and my sister was with her. She thought, you know, Liz is going to be with me the whole time. You kind of know where this is leading, right? So she didn't bring her button. Well, I went to the hospital, saw patients. It was on a Saturday, and I called her just to check in. She didn't answer, which, you know, I thought maybe she was just outside enjoying Florida sun instead of the Michigan winter. Got home. The door to my garage was open from the laundry room. And I heard her voice saying, "You won't believe what happened." So I went out there, and she was on the garage floor. I knew she broke her hip. I didn't tell her that. Fortunately, she was only on the garage floor for about an hour. I quickly got things together because I knew we were going to the hospital. But that's a good example, unfortunate example of just, I can't say it and emphasize it more, the alert buttons. And they have ones now that will go out with a greater radius, if you will. It's not just in the house. So they're getting smart with those. All right, so what can we do to prevent falls? Which one do you think? Which of the following is most effective for preventing falls? Strengthening exercises, aerobic exercise, balance exercise, or a little bit of both, or all of them, rather. Actually, the studies have shown balance. Balance exercise is the most effective in preventing falls, and we'll talk a little bit more about that. Why am I going to talk about osteoporosis? Because with falls, we're concerned about fractures. You think of bone as being static, like once it's made, it's there, but it's constantly being remodeled, if you will. There's little cells like Pac-Man destroying bone, and then there's other cells that are laying it down. And so it's constant. This process is constantly going on. It repairs itself by this active remodeling. So, but what happens after menopause, both men and women, as you get more mature, there's more resorption of the bone and less formation of bone. So bone loss leads to osteopenia, osteoporosis, and fractures. 2 million broken bones in the US annually related to osteoporosis. 1 in 2 women after menopause and 1 in 5 men over age 50 will have a fracture. Incredibly prevalent. And you know, how many of you know someone who's broken a hip? Okay, well, that's a majority. So you know what happens. I mean, decreased quality of life, can't get around, the loss of independence. We're coming back to where I started the talk, loss of independence. 60% of women do not recover their previous level of function after a hip fracture. They never return to how you were before the fracture. And had someone not had a fracture, I mean, with the hip fracture, you're 20% more likely to die, if you will. So what's the definition of osteoporosis? It's bone mineral density, having the bone density test done, the DEXA scan. It just gives a number. If the number's less than 2.5, from 1 to 2.5, osteopenia, 2.5, excuse me, over 2.5, osteoporosis. Get the bone density test, review it with your physician. Okay, now what can we do without the physician, without the medication? Exercise. Weight-bearing exercise. Recommendation is at least 5 times per week for 30 minutes. So the weight-bearing exercise is going to build up the bone. The balance exercise is going to help prevent the fall. Calcium and vitamin D. I know recently there's been some controversy about how much calcium. I stick to this, 1,200 to 1,500 milligrams of calcium a day. Get it from the diet. Most people can't. But so then you take the supplement. And vitamin D supplementation as well. Stop smoking, avoid excessive alcohol. I think you're seeing the theme here about exercise. Marked decrease in physical activity or immobilization actually makes the bones weaker. So bad pneumonia, you're in the hospital, you go to rehab, you're just not moving around, you're going to become more osteoporotic. Walking, we're back to exercise. And it doesn't, you don't need to become an athlete. Just do something. Just start moving. I say everyone has a favorite program on TV. The average 30-minute program on TV, how many minutes of commercials do you think? Less? Half? Pretty close, actually. It's like almost 12 minutes of commercials. So there's a trigger. You know, stand up, walk around, march. Simple balance exercise. And you want to do it safely. Hold on to a chair, the back of the couch, the counter. 1 foot up. You're going to let go. Now you'll see my balance. So maybe I shouldn't do this. But you're going to let go and work up to 3 minutes. Simple. While you're watching the Sesame Street or McNeil Lear. Dementia. I'm just going to speak very briefly about dementia. That could be 2 or 3 more talks. But we're going back to where we started, which was staying independent, having quality of life. And I'm just going to briefly tell you that, guess what? Exercise can help the brain. They've actually proven that just the 20 to 30 minutes, 3 days a week, increases the part of the brain that's critical for memory. I'm just touch about memory, what's normal, what's not. You're watching TV, oh, I can't think of that actor's name. 2 hours later, boom, it's there. That's the normal forgetfulness as you get older. Age-associated memory impairment. The other is you might not be remembering where you placed the keys, where's the cell phone. the brain is not as good at multitasking. So you come in, put the keys down, the telephone rings, or put the keys down and you're thinking about getting to the restroom. That multitasking, you have to really focus. More about physical activity. One pill will not do all this. Exercise will. Physical activity reduces the risk of death from all causes. Cardiovascular disease is the CVD, and non-cardiovascular disease reduces the likelihood of death. Reduces the likelihood of coronary artery disease, clogged arteries, high blood pressure, stroke, cholesterol problems, diabetes. There we go, cognitive impairment, short-term memory loss. It helps in depression, osteoporosis, colon cancer, breast cancer. You're going to lose weight if you start exercising, and falls. There's not a single pill that's going to do that. And the last slide was saying about preventing those conditions. If you have those conditions, any of them, physical activity is going to help. Therapy, a therapeutic role. So what are we talking about? What I say is whatever you do is great, because you're doing it. The ideal is an aerobic component, getting that heart beating, okay? So walking, running, swimming, bicycling, using stairs, going to the gym. But just walking, you don't need equipment, just walking. And work up to it, work up. Don't say, okay, she said go out and I need to walk 20 minutes this afternoon, and then you come home exhausted, your muscles ache, and you think, I'm not doing that again. 5 minutes. All right, so aerobic physical activity, preferably 3 or more days per week. All sorts of things count, working in the yard, walking around the house. But again, you want to get up to kind of huffing and puffing a little bit. And here again, some activity is better than inactivity. Too much sitting increases the risk of early death and not being able to do what you want to do, diseases. Here's the balance training. We talked about standing on one foot. I would not recommend the heel to toe and backward walking by yourself. Maybe dancing would do the backward walking. Tai Chi is the one type of exercise that's actually been proven to decrease the likelihood of falls. So exercise, aerobic component, again, anything you do is great. But aerobic component, so what I say, if you're taking a walk with a friend, which is the best way to do it, because then there's a little peer pressure. You're going to set a time and you're going to do it together. You can keep up a conversation, but it's a little tough. You don't want to be huffing and puffing that you can't keep up a conversation. So that's the aerobic component. The balance we've talked about. The other two is strength exercises. Walking is weight bearing, but even the free weights. The other is flexibility, stretching. Medicare's very generous with paying for physical therapy. You can go to your physician, and there's very easy diagnoses that Medicare will cover. Gait and balance disorder. Work with the physical therapist, get the home exercise program, build up your confidence. Okay. I'm just going to touch on one last bit, and this is with Dr. Seuss. I'm a primary care physician, so basically an internist. I'm a specialist in taking care of mature adults, but I really see as the role of an internist, a geriatrician, family practitioner is coordinating care. We certainly need the consultants, but Dr. Seuss experience here. This is the patient being wheeled in to see all those doctors. Then, into the new wing, we'll see Dr. Spreckles, who does the 3 Fs, footsies, fungus, and freckles. And next we'll drop in on Dr. Jins, our A&S man, who does antrums and shins. And of course, he'll refer us to Doctors McGrew, McGuire, and McPherson, and Blinn, and Ballou, and Timpkins, and Tompkins, and Diller, and Drew, Fitzsimmons, Fitzgerald, and Fitzpatrick, too, all of whom will prescribe a prescription for you. All right, well, hopefully your kitchen counter doesn't quite look like that for the morning. All right, so for your pill drill, you'll go to room 663, where a voice will instruct you. Repeat after me. This small white pill is what I munch at breakfast and right after lunch. I take the pill that's Kelly green before each meal and in between. Those loganberry colored pills I take for early morning chills. I take the pill with zebra stripes to cure my early evening gripes. These orange tinted ones, of course, I take to cure my Charlie horse. I take 3 blues at 8:30 to slow my exhalation rate. On alternate nights at 9 p.m., I swallow pinkies, 4 of them. The reds, which make my eyebrows strong, I eat like popcorn all day long. The spreckled browns are what I keep beside my bed to help me sleep. This long flat one is what I take if I should die before I wake. With geriatrics, one of the hallmarks with treating mature adults, take all your pills, prescription and over the counter. We call it a brown bag session. Take it to your physician. They may not want to look at it, but you're taking them, and take all of those in so they can be reviewed every year. We do it a little more frequently in the office, because you don't know what is getting added by the consultants. Your primary care doctor may not know. So brown bag, take everything in. Last but not least, so I've emphasized exercise. The other is having a purpose, finding a passion, a reason to get up, get dressed, get out of the house. This lady is holding a baseball in her right hand. This is Tiger Stadium, Detroit Tigers. It's Co-America Park in Detroit. And she requested to throw out a first pitch for her 90th birthday. And she practiced, actually, during the summer, throwing. She's not on they don't put you on the mound. They put you halfway down. She got it over the plate. And now, my mother's 93 years old. Her passion is the Detroit Tigers. Yeah. Thank you. Questions?
The incident you said falls at nursing was greater than falls at home. One would think that in a skilled nursing facility, the opposite would be true. Why would that be greater in the nursing home?
So the question is, why are there more falls in a nursing home than in the community? And are you thinking that there shouldn't be as many because there's staff? Okay. You can fall pretty quickly. So, you know, in the hospital, they have bed alarms. And as soon as you stand up from the bed, the alarm goes off. So if you're ever visiting someone and you hear this beep, beep, and then all these people are running trying to find out what room the person is that just got up off the bed, it's a matter of seconds that someone can fall. So it really is, and it's also, it speaks to the frailty of individuals living in skilled nursing facilities, living in nursing homes. I'm not talking about rehab, but actual living in the nursing home. They're just more gait and balance disorders. And not actually very good at exercising people who are living in skilled nursing facilities. If you've visited, you'll see the lineup of wheelchairs in front of the TV. Maybe, a sit and be fit sort of exercise. Again, anything is better than nothing. But wheelchairs are meant for transportation, not sitting. Yes?
I have
Sure, I'm going to come close to you so the question can be picked up.
Besides Tai Chi, do you think yoga or Pilates, if you're fit enough, are beneficial?
Yes, so besides Tai Chi, what about yoga and Pilates? The yoga is great because it's flexibility, it's strength, and it's balance. Yoga is wonderful. And what I like about yoga is that part of the, the theory with yoga is just do what you can do. And that's, I think people get intimidated. They go to a yoga class and they see, the instructor doing backflips or whatever. It's just do what you can do. And you have to, listen to your body. And Pilates is great. I mean, it's also weight resistance and it's stretching. Yes?
Do you think there's any benefit for increasing your memory to do mental exercises? I mean, I'm thinking particularly there's a program that keeps being advertised to do on your computer, to do like a brain program every day.
Yes,
It's called,
I'll think of it in 2 hours and I'll call you. I want to say luminosity, but that's not it. Is that it? Luminosity? Okay. So brain exercise, yes. I didn't speak to that, but there's definitely, you just got to keep active, keep social, and that's the reason. Another reason you have a purpose: get out, volunteer, keep social, be social. Crossword puzzles, reading is passive, so it really doesn't challenge the brain. But I don't know the data on that luminosity. Yeah, I don't. But that could be certainly another talk. Yes. Go ahead. Yeah.
Thank you. I read somewhere that the chances of surviving a bad fall is far greater when you're in your 60s and when you are in your 80s, rather than that of being in your 70s.
Oh, interesting. Okay, so you're more likely to survive if you fall 60s and 80s. So 70s is the great decade where you're less likely to.
And the reason they were giving was that, generally speaking, in your 60s, you're still relatively a healthy individual if you are living and doing your exercising and everything else. Those who are in their 80s and have taken a fall and have survived and were active all through those 60s and 70s, mm-hmm. because they were that active, they too will survive. Whereas if you're in your 70s and you haven't been doing that in your 60s, the chances are that actually, the mortality rate is greater in the 70s.
In the 70s. Mortality rate greater in the 70s. So you're more likely to die if you fall when you're in your 70s than 60s and 80s. I hadn't heard that before. Interesting. I hadn't heard it though. Yes?
My mom is 85 and she is very achy all over, pretty much every day. She was wondering if she doesn't have rheumatoid arthritis, and she just started talking about that. How do we know if she has that?
Well, the best thing to do would be for her to go to the primary care physician. If you don't feel like the primary care physician is addressing and she has traditional Medicare, you can certainly go to a rheumatologist. And as far as diagnosing rheumatologic conditions, it's 90% is listening to the patient. Exactly. So it's taking a good history, it's physical examination, probably some blood work, some x-rays. Okay. But I hope that helps. Hope she'll feel better.
Thank you.
Yes? We will be, thank you, we will be taking new patients in the beginning of next year. But we won't be scheduling until next year. Yes?
Relative to what she was talking about, do you recommend exercise for rheumatoid arthritis? I mean, if it's painful, do they work through the pain?
Well, so recommendation of exercise for rheumatologic disorders. Yes, I mean, you want to move those joints. But you have to listen to your body. You know, I mean, if it's, and also, you know, under the direction of a good occupational therapist or a physical therapist to learn how to do the exercise appropriately. Thank you very much.
Thank you.